I'd like to introduce our friend, Mr. Matt Fox. He's got a lot of titles behind his name. LMHC and a CAP, is a graduate of University of North Texas with a master's degree in community counseling. He's a licensed mental health counselor, a qualified supervisor, a certified addiction specialist, an international certified drug and alcohol counselor. He's practiced psychotherapy since 1996 and has experience in mental health counseling, substance abuse counseling, and relationship counseling. He has worked with a variety of populations, including adults, adolescents, and persons suffering from substance abuse, trauma, and severe and persistent mental illness. He has conducted trainings on emerging psychotherapies in Europe, Australia, and the United States, and is a popular speaker on mental health and substance abuse. He's actually presented several meetings for us. He's been a very good friend for ours. He's an author of a book, Emotion, Freedom Techniques, and Yoga Psychotherapy, which is going to be available soon on Amazon. And he's currently employed by Baycare Behavioral Health in Brooksville, where he was awarded the Baycare Beacon of Quality Award in 2013. He's just a great all-around guy anyway.
Sounds pretty impressive. You wouldn't think it to look at.
Well, we thank you very much for coming and doing this for us.
I'm really happy to be here. Okay. So, I'm hoping to speak loud enough so everybody can hear me. I never turned down an opportunity to hear myself speak. So if you guys will bear with me, what I usually talk about is the brain, how the brain works, how trauma occurs, how substance abuse affects the brain, and how recovery occurs. Because recovery from mental health and substance abuse problems is possible. Okay? I'm thinking that if you guys have like a short question that I can avoid rambling on about, just go ahead and shout it out, raise your hand or something like that. Rita knows that the problem with me is I don't know when to shut up. So I'm going to try to round this thing out here in about an hour, but it's probably going to run a little bit longer than that because we're going to cover a lot of different material here and people like to ask a lot of questions about this stuff. Okay? All right, so we have this thing we call the MacLean-Papez triune brain theory. And what that means is that there are three different parts to the brain. And these three different parts of the brain are very independent of each other, and they each have their kind of an awareness. It's kind of like three people that don't like each other very much, and they live in a really confined space. Okay, so there's a lot of quarrels and stuff like that that go on between the three parts of the brain. The first part of the brain is the brain stem. Now the brain stem is probably the most basic part of your brain because it keeps your heart beating, it keeps you breathing, it keeps you alive. It's just about survival, so we call this the survival brain. It's only interested in self-preservation. So it tends to predominate in things like lizards and snakes and politicians and lawyers and stuff like that. Things that are just basically self-centered, want to survive, okay? The next part of the brain that came along was the mammalian brain. We call this the emotional brain. This part of our brain allows us to experience emotions and to become attached to people and things because when mammals came along, a part of the brain had to evolve that would keep us from eating our young like a lawyer or a politician might. Okay, so we get attached to them, and then when they're about 17, we want to strangle them, and then after a while they become adults, and then they're much easier to get along with. Okay. Now the last part of the brain that came along was the neocortex. Neocortex means new brain. It's the human brain. Okay, and the most important part of this for our talk today is the neocortex. Those are the frontal lobes of the brain. They start developing when you're about 12 years old, and they're not fully developed until you're about 25, and some people are saying 35 years old. Okay, so your brain is like a work in progress from the time you're conceived until you're well into adulthood. All right. Now the problem with this whole arrangement is that these lower parts of the brain have a way of overriding the thinking part of the brain, or really influencing the thinking part of the brain. Right? So when we start talking about addiction, we're talking about the pleasure areas of the brain. If it feels good, it makes us want to do it again. Now that could be riding roller coasters or smoking crack, all right? Pleasure means we want to do this thing again. The pleasure areas of the brain start off in the brainstem because they're survival things, and they spread out into the emotional brain and into the neocortex. So all three parts of the brain participate in pleasure. So every time we do something like this, it feels good and we want to repeat that experience, eventually the brainstem takes that and puts it in the same category as oxygen. So now it says, I have to have this in order to survive. Okay? Now because it's a survival issue, it's going to override the thinking part of the brain in order to get what it wants. So when a person's experiencing a craving for tobacco, that's the brainstem saying, we got to get some nicotine in here, we're going to die, man. So it starts kicking out all of this anxiety and all this other kind of stuff and cravings, and it just gets way out of control. And what the thinking part of the brain says, because it wants to believe it's in charge, it says, I'll quit tomorrow, not such a big deal, everybody I know does this, it ought to be legal, it grows out of the ground so it must be okay. It's not my fault I got all those DUIs, it's the cops, they all hate me, right? It's my boss's fault, it's my kid's fault. So what we tend to do is we tend to minimize, blame, and deny, all right? That's the kind of thing that we as substance abuse counselors run into a lot of times when we meet people for the first time. They really don't want to, own up to the fact that this is an issue. So we have ways of dealing with that. Anyway. Another aspect of this problem is that the further down you go in the brain, the harder it is to make changes. So every time you learn something new, you're making new connections in that neocortex, all right? It's constantly making new connections, okay? It's harder to make changes in that emotional brain. So once a person's experienced a trauma or something to that effect, they might need some professional help to get through this stuff, all right? Once those changes have been made down in the brainstem, they're pretty much permanent. So that means that once an addict, always an addict. If I've been smoking a pack a day and I quit for 10 years and I pick up one cigarette, what happens to me?
I get it.
Right back to smoking again. And if it was a pack a day, I'm right back to a pack a day real quick, right? So that's our conundrum, all right? Most people don't realize, oh, I've got a problem with alcohol, so I'm going to run down to AA or go to detox or something like that and get that taken care of. Instead what they want to do is they want to control their use. They don't want all the stuff that goes along with the addiction, but they don't want to give up all the benefit of the addiction either, because there are some benefits, like you don't have to feel pain, stuff like that, all right? But eventually the consequences outweigh the benefits, and now we need to do something about that. So they want to control their use, and then they find out, because they've made these irreversible changes, they can't control their use. They always end up right back where they started from. So the next thing they figure is, well, the drugs are a problem, I can't seem to control my use, I'm just going to quit using. But I'm going to hang out with the same people, go to the same places, do the same things, right? And they say in Alcoholics Anonymous, you can't hang out in a barbershop without getting a haircut, right? So sooner or later they're going to say, a little bit of alcohol, a little bit of pot, that's not going to hurt me, and the next thing you know, they're off and running again, all right? Now, at that point, they figure out the drugs and the alcohol are a problem. I can't seem to control my use. I can't hang out with people who are using. I need to make lifestyle changes. And that's where going to programs like Alcoholics Anonymous, Narcotics Anonymous, church groups, anything that is focusing on a new way of life is really important. But what has to happen before that occurs is people have to change people, places, and things. And that's a really, really basic thing. But it's a problem for people who have substance abuse issues because they're what we call emotionally arrested. So if a guy starts smoking pot when he's 14 years old and he comes to see me when he's 40, emotionally he's still 14 years old. He's never grown up, basically. So he's still acting like a teenager, he's still thinking like a teenager. And so do you think teenagers like to give up their friends? Of course not. So they have to go through this process. And what we have to do is we have to kind of help them to come to the conclusion that this is a problem, you need to do something, you need to make lifestyle changes. So I kind of got off on that thing for a second. Is this making sense?
Yes.
Oh, yeah.
Okay. All right. So, one of the big problems we have with relapse prevention is that the eyes are wired into the brainstem first, and then that information goes to the emotional brain, and then from there it goes up here to the frontal lobes of the brain. All right. So, see a guy who's trying to stop smoking pot, and he sees a bong. This is my picture of a bong. Okay. That information comes in through the eyes, through the optic nerve. It hits the brainstem first. The brainstem gets the information a fraction of a second before the rest of the brain gets it. And that means now, boom, it can take over. All right? And now the guy's thinking, one hit, that's not going to hurt me. Okay? So, that's why it's important to change people and places. All right? One thing about changing people also is if you're hanging out with people who are still using, and you say, you know what? I'm drinking a 6-pack a day. I need to quit drinking. I'm going to tell Bob, I'm going to hang out with you, but I'm not going to drink. Now, Bob, he's drinking a couple of 6-packs every day, and he's thinking, hey, if he thinks he's got a problem where he's at, what does that say about me, right? And so now we got a big problem here. I got to get this guy drinking again, right? And so what he'll try to do is sabotage that person and drag him right back into that same activity. And a lot of times our families will do the same thing, which is a big problem for some clients who have families who are still drinking and drugging. Because they're telling them, you're not a part of this family unless you smoke meth, right? And so now we have to make a choice. I'm going to hang out with my families and keep using and getting in trouble, or I'm going to get a vacation from those guys until I get my head on straight, and then maybe I can get back around them. Okay? So when I'm working with people like that, I tell them, look, just try to avoid the family for a year or so, and then later on, maybe you can come back around them. But it's really hard for people to accept when people have decided to quit drinking and drugging. Okay, so where am I at with this? Oh yeah, and that emotional brain, that brainstem will also override the emotional brain. And so that's where you see people who are, trading their kids for cocaine and stuff like that. So when a person's in active addiction, the most primitive part of their brain is basically running the show and making all the decisions. And it doesn't care about consequences. It doesn't care who gets hurt. All it knows is it wants what it wants when it wants it. Okay? All right. So, moving right along, the first part of the brain to be damaged through drug use and alcohol use is the frontal lobes of the brain. It's the first part to go, the last part to come back. If a person drinks one drink, their brain is impaired for 24 hours. If they get drunk, their brain is impaired for 30 days. Okay?
30 days?
30 days. So if they're just drinking heavily on the weekends, that means that they create this downward spiral. Every time they get drunk, they're causing more damage to the brain. All right? Eventually people can develop a thing we call wet brain, where people are actually having a lot of the same symptoms you might see with schizophrenia and stuff like that, just from the brain damage. So the other thing is it takes 90 days to recover from a crack binge. All right, so trauma has a lot to do with this. Not only do you have these three parts of the brain, you also have the two halves of the brain. If you look at it, it looks kind of like a walnut. So the right brain is very now-oriented. It thinks in pictures. It sees the overall scope of things. It kind of looks at the big picture of everything. It connects things and that kind of stuff. The left brain is more past and future oriented, and it's language oriented, and what it wants to do is make sense out of what's going on. Okay, so it helps us to organize our experience, tell us who we are, that kind of stuff. And these two halves of the brain are connected with a bunch of connections called the corpus callosum. Now, women have got more connections between the two halves of their brain than men do, and that's why women have better access to their emotions and can express their emotions better, and men act like they got half a brain. okay? You guys have heard that before, right? Yeah, you saw that coming, all right? We can't help it, all right? Women tend to think more side to side, men more front to back, that kind of stuff. So it's just a fact of brain function, all right? Now, you guys have heard of rapid eye movement? Everybody heard of REM sleep? So REM sleep is a phase of sleep where you're dreaming and your eyes are moving back and forth rapidly like you're watching a ping pong match. Now, for a long time, they didn't know what that was about. They just assumed people dreamed a lot about ping pong and tennis and stuff like that. But what they found out was you learn something during the day, and then at night while you're experiencing rapid eye movement, you're actually processing that stuff from one side of your brain into the other. So your brain is actively wiring itself in your sleep, right? Now, how this affects our mental health is something like this. If we don't get enough REM sleep, we start to hallucinate. So anybody who stays awake often long enough is going to start to hallucinate. They start dreaming while they're awake, basically, is what happens. So when we get people who are using methamphetamine or cocaine or one of these stimulant drugs, and they stay up for a week or so, they can start getting paranoid, they can have hallucinations and hear voices and have all kinds of things. A lot of stuff that we would associate with problems like schizophrenia. In fact, back in the 1960s, when the hippies out in California started using a bunch of methamphetamine, they would stay up for a couple of weeks and then they'd start hallucinating and they'd end up in the mental ward, and the doctors would say, oh, this guy's got schizophrenia. So they'd give him some Thorazine or something, he'd sleep for a couple of days, he'd get up, he'd be fine. And so then they had to figure out, oh my God, it was because these guys have been using methamphetamine, all right? Now, what we have to understand is that there's a certain threshold for trauma and stress in the human brain. And some people have a very high threshold for that stuff, so they can go through wars and stuff like that, and they come out of it and they're just fine. You got other people have a very low threshold for trauma and stress. We call that stress vulnerability. So they're vulnerable to stress. When that happens, that can really affect the way that their brain works. And I'll get back to that here in a minute. All right, is all this, am I making sense?
Yes.
Okay. So, what we see a lot of times is people have their first psychotic break, late teens, early 20s, and guess what's going on in the frontal lobes then? Frontal lobe development, okay? It's making connections, all of this stuff is going on, and this is when things can start to kind of go haywire for some people. When a person is traumatized, the trauma is just too emotionally loaded. And again, different people have different traumas. Some people it might be grandpa died, other people it might be, my goldfish died or something like that, right? So it could be stuff that most people are like, well, that's not such a big deal. But for us, maybe that's a big deal, right? So when we become traumatized, now this stuff is stuck in one side of the brain and it can't be processed. So now we're having nightmares about this stuff, right? If we see something up here in the environment that reminds us of that trauma, it activates that stuff, right? And now these feelings start coming up. Grandpa dies, I see a picture of Grandpa, now I feel really bad, all right? And then we develop these background noises in our lives of anxiety, depression, anger, stuff like that, and that kind of becomes wallpaper. So it's like one day I'm this happy little kid, and then something terrible happens to me, and now I can't stop thinking about it. I'm having nightmares, I'm having flashbacks. Sooner or later, I say, you know what? I'm just going to quit thinking about that, right? So that executive brain kind of pushes that down into the basement, and now it starts tearing up the plumbing because this stuff has not been successfully resolved, all right? Now, because this gets stuck, that means everything that comes along behind it that has the same emotional tone gets stuck. And now we develop these things called trauma chains or trauma stacks, because the brain will organize things according to emotional tone. Now if something happens out here, the thinking part of the brain might not even recognize what's going on, right? Something triggers this trauma, and now all of a sudden it triggers the entire trauma. We don't get just a little bit of that stuff, and now we're overwhelmed with the feelings. Now we're experiencing panic attacks and rage and all kinds of other stuff that goes along with that, okay? So when people are using drugs and alcohol, that means they have less control over these experiences. Still making sense?
Yes.
Okay, all right. Now, sleep is so important for teenagers. Now we know they should be getting 9 or 10 hours of sleep every night. Guess how much sleep most of the teenagers I work with get? 3 or 4, right? Okay, so, and if they're getting a lot of sleep, they might not be getting the right kind of sleep. So when people are depressed, for instance, they spend way too much time in REM sleep. So it's like stirring this stuff up, but it never gets processed, right? Okay, so sleep is a very, very important thing for mental health. Some people are real sensitive to not having enough sleep. I get a little crabby, you know, if I don't get enough sleep. So my wife likes to know that I get a lot of sleep. Right? If you're a teenager and your brain is developing, your frontal lobes are developing, and you're up all night playing video games, and your parents say, go to bed, and then you go to bed, and you lay in bed until they go to sleep, and then you get to start playing video games again,
I used to do that.
probably not the best thing for your brain development, okay? Because you're not getting enough sleep, all right? And when people are adults and they're experiencing mental health issues, and they don't get enough sleep, now they start having some symptoms related to their mental health issues. They can be very sensitive to lack of strict sleep. When you start throwing crack cocaine in there or methamphetamine in there, now they've even got worse problems. So when we got people who have an existing mental health issue, like depression or schizophrenia or something, schizoaffective disorder or something like that, and on top of that they've been trying to self-medicate by using drugs, it just makes it that much worse. Okay? All right. So, we have this calm and serene center of being that's our true nature, and that's who we really are. That's who we are from birth, basically. I mean, when babies are in the womb, if it's a good womb experience, it's just, they don't have any concept of boundaries, right? They feel like they're at one with the mother. They don't know that there's any difference between them and their mother. They don't realize they have hands or any of this other kind of stuff. When they're born, at some point, they start to realize that they've got hands that can pick things up and put in their mouth. You know how babies do that? It's because that's where all the nerve endings are, is in their lips. They don't really develop their full peripheral nervous system for a while after they've been born. And they start to recognize that they've got boundaries. There's me and there's that. And there's good things and there's bad things. And they learn how to pleasure and pain. You know, wet diapers aren't real comfortable, so they're going to cry about that. And that's when that left brain starts kicking in. It starts making connections. It starts taking a shape out of the world, or making boundaries and that kind of stuff. You know? So basically, this is our true nature. Calm and peaceful and serene. The traumas that come along behind that are the problems for us. So when that left brain is developing, it acts like a lens or an interface through which we view the world. Okay, we're developing language and thoughts and everything, and usually about the age of 12 years old, little kids start getting interested in the world and what politics are, and they start thinking, developing an internal dialogue where they kind of talk to themselves and stuff like that. Prior to that, they don't have a whole lot of that going on. Little kids don't have much frontal lobe in there, so that's why they run out in front of cars and stuff and throw temper tantrums and stuff, because they don't have a lot of good emotional control or impulse control. In fact, there's this real famous study that they've talked about again recently called the marshmallow test. And in the 50s, they would get these kids and they'd sit them in front of a marshmallow. And they'd say, okay, Tommy, you can eat this marshmallow now, but if you wait 5 minutes, I'll give you 2 marshmallows, right? And Tommy's like, okay. and you can watch him as he's like squirming around in his chair, oh my God, you know, and then some of these kids just said, ate the marshmallow, right? They have poor impulse control. And then they were able to follow those kids for about 20 years, and what they found was the kids who ate the marshmallow were the ones who tended to have more problems with substance abuse and mental health issues and relationship issues and anger issues and all that other kind of stuff. Okay, so this is a lens through which we view the world. If we have a pretty good lens, we get a pretty accurate picture of what's going on out there, right? But if we have a lot of traumas in that lens, now those traumas distort that lens, and now we don't get such an accurate picture. All right? You know, we grow up watching the cops drag mom and dad off to jail and stuff. After a while, we just don't like cops. You know, we don't care what they're doing. We don't like them, right? It's distorted. We don't see the world the way it is. We get bit by a dog. Years later, we forget about being bit by the dog, but we can't stand dogs, right? Okay, that emotional part of the brain knows what's going on. This part of the brain here is like, I don't know why I don't like dogs. Or, I don't know why I don't like this person, or why I do like this person. It's triggering stuff in here in this emotional part of the brain, and then that stuff is really influencing the way we think and the way we perceive the world. So, after a while, we start to develop this, and that is like a false self. This is who we think we are, okay? Because we think we are our history. We think we are our feelings. We think, I am angry. Okay, well, no, I'm not angry. I have this anger. Right? I'm experiencing anger. It's not who I am, but right now, for some reason, I've got this going on with me. All right. So, let's say this is a girl who's growing up in a family where there's a lot of chaos going on in that family, where there's addiction or alcoholism or some kind of abuse or gambling problems or something. There's always like, everybody's just living right on the edge, right? A lot of chaos going on in that family. She's coming home from school every day, and she has this feeling of impending doom. She doesn't know what's going to happen when she gets home because, you know, yesterday the cops were there, and last week and nobody was there, and the baby was there and needed to be fed, and they weren't wearing any diapers, and all this other kind of stuff is going on with her. So she's growing up with this feeling of anxiety, right? Now this emotional part of her brain, it doesn't care if this stuff makes sense or not. All it knows is, this is the way I'm supposed to feel. It's irrational. So it gets used to this feeling. Now, when she goes out in the world and she gets involved with some guy who's calm and peaceful and treats her respectfully and stuff like that, she thinks there's something bad wrong here, right? So she's probably going to dump him because she thinks he's boring, or she's going to want to stir some crap up in that relationship because she has to have that feeling, right? She's going to be more likely to be attracted to some guy who's like Billy Bob Badass, excuse my French, because she's going to feel more safe with him. I feel nobody's going to mess with me as long as I'm with Billy Bob, is what she's thinking. Okay? What she doesn't realize is that this guy grew up watching his mom getting beat up, so he has all this trauma. And meanwhile, this thinking part of his brain is saying, I'm never going to treat my wife like that. Right? But meanwhile, this emotional brain is getting wired to do this kind of stuff. So at some point, somebody says something, somebody pushes somebody's button, and the next thing you know, they have recreated their family system. So one of the things that we see happen in alcoholic families and families where there's drug abuse is that people either come out of those families being alcoholic themselves or being complete teetotalers, but even if they're complete teetotalers, they tend to be attracted to people who are alcoholics, all right? Because they're comfortable with that craziness and stuff that's going on, okay? It's not until they get some insight into what's happening to them that they start to recognize what's going on and what they can do about it. All right? Yeah.
Is that like one of the first forms of addiction? Like you're addicted to a certain chaos or?
Yeah, so that can be one of the first kinds of addiction, is that we actually become addicted to our emotions.
To the chaos that we
Right.
feel.
We love that.
Because
And
we
if
don't know how
get
to
it,
change it?
right. Well, it's just so comfortable. I mean, it doesn't matter. People who grow up in those families are really good in a crisis. Right? Because they know how to call the cops and how to staunch blood and all that other kind of stuff. They're not very good with peace and quiet. All right? So they have to stir something up. They have to keep that thing going. You see people get addicted to gossip. So in 12-step meetings, you see a lot of guys and girls who are addicted to gossip, or they might get addicted to relationships. They might get addicted to anger or to work. You know, whatever it is. One guy that I was listening to recently said that he defined addiction as something that you can't stop doing, right? It's out of control. Okay, so it's making sense so far?
Yeah.
All right, yes.
So you got a little boy growing up in a marriage where the father is abusive toward the mother.
Right.
Does he grow up to become an abuser toward his wife usually?
He can. Now this is the deal. Nobody, it's not 100% one way or another. Okay, so the brain is very unpredictable. A lot of times people can come out of really chaotic situations and be very good people. Other times they can come out of really bad situations and not be such good people, or they can come out of really good situations and be bad people.
Yeah.
Right, so there's a lot of variation. No two human brains have ever been the same. They're shaped by genetics, but they're also shaped by experience. All right. One thing we talk about in this business is Axis 2 stuff, and Axis 2 means that basically this person has a problem that we can't do a whole lot about. And one of those issues is what we call antisocial personality disorder, and it's also known as a person who's a psychopath or a sociopath, and these people don't experience guilt or compassion or empathy. They lack that stuff. Okay, so they tend to be criminals or politicians or lawyers or something.
That's true.
What
It's
causes
actually
that?
true, yeah.
What causes
It's
that?
genetic. It's about 80% genetic.
Wow.
Now, it used to be back in the old days, that was a really helpful thing, because somebody was attacking your village, you needed to have somebody in charge who didn't care if you got your arm cut off, right?
Yeah.
Okay? But nowadays, we don't have that so much, right? So these guys and women, they just don't really fit into our current society. But even those guys, if they're growing up in a good, healthy family, and they don't have a lot of traumatic stuff happen to them, they can actually become good people. Right? It just depends on what happens. It's kind of like the perfect storm of trauma and genetics and substance abuse and all that kind of stuff that happens. It kind of brings this stuff out.
Psychopathy can be reversed?
Not reversed.
Not reversed?
No. Actually, there was a great program on, I think it was the History Channel, called Psychopaths. And it was about this guy who was doing studies of brain scans of people who were psychopaths. And he noticed that they all had this stuff in common, which was that they a lot of times would have frontal lobe damage, and then they would have this history of trauma and stuff. But he could look at these scans and pick out which ones were the psychopaths and which ones weren't. Okay, and so then his buddies showed him some, and he was picking them out. And then he looked. He said, "Okay, those are all psychopaths." And they said, "Well, you see this one here? This one's yours." And it turned out that the psychiatrist who was doing the study had all of the symptoms of antisocial personality disorder. But he grew up in a really good family. He was actually related, as it turns out, to who was that girl who took the axe and whacked that guy?
Lizzie
Lizzie Borden. He was a relative of Lizzie Borden.
Oh, wow.
And there were something like 17 murderers in his family. Now, there are other Axis 2 things that are more related to trauma. So when you talk about borderline personality disorder, that's a person who has experienced a lot of trauma, and they see things very black and white, and they have wide emotional, they have difficulty controlling their emotions and that kind of stuff. And that really has a lot more to do with trauma, I think, than it does genetics. Okay? Although it still runs in families, because everybody thinks this stuff is normal. Right? If you grow up in a family where people are just used to whacking each other and beating each other up and drinking and using drugs and stuff, everybody in that family just assumes, well, everybody's family's like this. This is perfectly normal. Right? So they just continue that stuff over and over and over again through the generations. So nobody's really at fault. You know, everybody's doing the best they can with what they've got. Some people just don't have as much as other people. Okay. Any other questions about that stuff?
Is there any help for a psychopath?
Well, if they can accept that they've got this problem and decide to do something different about it, then yeah, that's good. But see, people who are psychopaths tend to be very manipulative and very charming. And everybody just loves these guys, and then they find out later on that maybe I shouldn't have trusted that person after all.
Wolf in sheep's clothing.
Yeah. Now, not all mass murderers are well, not all psychopaths are mass murderers, but all mass murderers are psychopaths.
Yeah.
Because they don't experience compassion or empathy for other people. So, you know, talking to another person is the same to them as talking to that TV or something. There's just no real emotional attachment there. Okay. All right, any other questions about this stuff? All right, so I think yes?
Is there a pattern that shows with people that are going through that, and then is it like patterned?
Yes,
All
absolutely.
like the reaction, the depression, it's all patterned.
Right, there are patterns that develop, especially like in a relationship. So for instance, when people are in abusive relationships and they leave that relationship, they end up going back to it, or to another one that might be less abusive, but it's still abusive, that kind of stuff. There's patterns as far as when we talk about bipolar disorder, then we see that some of this stuff is actually seasonal. I mean, it's pretty normal to have ups and downs in your life, but when people have wide ups and downs, that tends to be more of an issue. I actually have looked at the DSM-5, which is the new version of the Diagnostic and Statistical Manual of the American Psychological Association. And they say that bipolar disorder is actually a symptom of trauma. So the trauma throws off the brain chemistry, and now you have these wide mood fluctuations and stuff like that go along with it.
Oh, can it be a learned behavior from watching the
You
adult
can.
in your lifetime be bipolar?
Sure. Or have schizophrenia. You know, I mean, there's a condition that's called Faux-le-doux. Do you know what that is? Okay. Well, it's this condition where a person's living with someone who has a mental health issue, who's delusional, and the spouse starts to subscribe to the same delusions. All right. So she's thinking, or he's thinking, well, yeah, the FBI is really after us, that kind of stuff, and she might be pretty normal otherwise, right? So the human brain it's a big mystery. We're just starting to kind of figure out how this stuff works and what we can do about this. Now, what I recommend that people do when they're working with me, we want to increase executive control by getting drug and alcohol free. All right. Now, prescription drugs is a different matter. So if you're taking them according to prescription and stuff like that, then chances are that's not going to be a big deal. We have had some recent findings, very strong evidence that benzodiazepines are a big cause of Alzheimer's disease.
Yeah, I read that.
Right. Benzodiazepines are drugs like Ativan, Xanax, Valium, those kinds of drugs. And basically, they tend to be very addictive. So when a person has been on these things for a while, they really should be coming off of them under a doctor's supervision, because you can have seizures and all kinds of bad withdrawal symptoms coming off of that stuff. So if you happen to be taking that stuff and you want to come off of it, then you want to talk to your doctor about that, because it can be a big problem for you if you just decide to quit. Now, anytime that you're wanting to come off of some kind of psychiatric drug, you really need to talk to your doctor about that.